Cervical cancer occurs when abnormal cells on the cervix grow out of control. The cervix is the lower part of the uterus that opens into the vagina. Cervical cancer can affect any woman who is sexually active, although it is believed that the deadly disease mostly affects women between the ages of 25 to 60 years. However, that fact has been revisited since some girls marry as early as 14 or 12. As a middle-aged wife and a mother of two, I took the decision to undergo the screening myself. I visited SOS Mother and Child Clinic, where screening for cervical cancer is free for everyone. I arrived at the clinic around noon just to give the other patients some privacy while they went through the screenings. Before the start of the screening, the nurse in charge talked me through the procedure with a detailed explanation of the test and the tools used.
We are looking for the precancerous cervix, and this is what cancer is all about. This is the healthy cervix, you can see. So without taking much time, we have what we call here the acetic acid. It is locally called vinegar. It's been diluted. This is what we use, as you can see. And we have a lubricant, because when we talk about the cervix, we have it right into the vagina, the upper end of the vagina. That is where you have the cervix, or the vulva. That is where you have the cervix. So that is why we use this lubricant to lubricate the instruments we use to view the cervix. And that instrument is simply called the speculum. It is covered because it's always sterilized before we use it. And we use it with cotton ball. This one, we make it for ourselves. You have a cotton and a stick. It is not meant to hurt any woman, because we know that place is very sensitive. So anything that is going there, we do it with carefulness, because we are trying to maintain at least 80 to 90% infection prevention. We have disposable gloves that we use, and a very good light to view the cervix. So this is what is all about, visual inspection with acetic acid. What we view is cancer, and we all know cancer is a deadly disease, but again it's an STI, it's a sexually transmitted infection. Women who are not sexually active mostly don't suffer from cervical cancer, unless in terms of genetics. Then you can be a victim of cervical cancer. And again, those who are sexually active, then it was age 25 and above. But now with experience, we came to realize that in the Gambia, women got married as early as 14 years. By the time they are 19 or 21, they are exposed to the HPV virus, which is the primary cause of cervical cancer. Now, from any age, a woman who is sexually active would definitely be qualified for the cervical cancer screening. As you can see, the procedure is free. All services offered here is free. But in case of any other abnormality seen, treatment would be given to you, and that one you have to buy it for yourself. And if need be, if there is any partner management necessary, then it means you have to do partner notification, and then we will manage your partner as well. This is all about the procedure. It's a simple procedure. It can be even done in your own bedroom and on your bed. It's very simple procedure.
On seeing and hearing the procedure, I cringed a bit as it sounded a little terrifying. However, the screening took less than 5 minutes plus an instant result. My result came with a conducted tour as we visit the cryo room. Here, the patients whose results come out positive are brought for a second screening. This is Sister Frances Njai, another team member of the Save My Mother project. She explains how the second phase is performed.
Now, this is the cryo room, as you can see. Here we have our cryo device, which is this one. This is the cryo device, and this is the gas that we use. So anybody that comes in with a VIA positive, when we say VIA positive, we mean that lesion has been seen, an abnormal lesion or abnormal lesions has been seen in the cervix of the woman. So from there, she comes here and, we do the cryotherapy. We do what we call cryotherapy for her. The same thing, she has to lie on the bed, on the lithotomy position, and then that's the cryo device. Okay. Then I have to put the gas on. Yeah, okay. I have to put it on, and then there I go and freeze the cervix. Okay. So as the woman lies, I just put this inside and then press for 2 minutes. Okay. And then the cervix is frozen. So that's what we call see and treat. That's see and treat. You come for screening. It's we find out that you're positive, so you come over here for cryotherapy to be done. And then when the cryo is done, you're given an appointment to come back in 6 months' time. So by 6 months, when you come back, we presume that the lesions have disappeared. May have disappeared by then.
What if they have not disappeared?
If they have not disappeared, we can still do another cryotherapy. We cannot perform another cryotherapy. Well, sometimes, when we do the screening and the cryotherapy is done also, we advise the woman to abstain for a month. So you have to abstain for a month. Sometimes it's difficult. Those are one of our challenges, because some women, they go home and tell their husbands that I was asked to abstain from sex, and then there's a problem. But we try to enlighten them that you definitely need not to have sex. If at all the husband still insists, you can still use condoms. Okay. Most of the ones that come back, they're the ones that did not abstain.
Okay. After getting an in-depth idea on the pap smear screening, the journalist in me stirred, and I had to ask, after years of working to eradicate cervical cancer, what was their worst-case scenarios? Their answers got me a bit emotional.
I've been working as a social worker here at SOS Clinic for the past 6 years, and the worst case scenario I have come across was when a lady, 28 years old, you understand, was diagnosed to have cervical cancer. We did all the advocation. We sent her all the way to Dakar. She went there, did chemo, everything, came back, but yet still she died, leaving 4 of her children behind at 28, and her last born was just a year old. It was that was my worst case scenario I've seen working in this project so far. Yes.
Since 2012, we've been doing this screening, and I think my worst case scenario is seeing a woman that has already had cancer walking to the clinic, for the screening, and when she gets up the bed, you just see gush of blood coming out, which means, that you can see the ulcerated cervix. That's my worst scenario, which means this woman, we cannot do anything for her again. It's just maybe palliative treatment. That's what they only have to do. Yeah.
Remember to visit the clinic for a free pap smear test. The screening is totally free, and cervical cancer can often be successfully treated when it's detected early through a pap smear test. The test is performed every 3 years. Know your status now and live a healthier life, a life without cancer.